Hello and welcome to another interesting edition of Health Watch. This week we're looking at something very different. Health Watch is a program that gives you information and educates you on issues or health issues surrounding or affecting men, women and children. But today we are looking at public health emergency preparedness. And the reason for this topic is because of the outbreak of Lassa fever in Nigeria and also the pandemic, the COVID-19 pandemic. And the reason is when things like this happen in a country like ours, we are supposed or we're expected to have prepared for it or have some kind of response plan on ground. So today our guest is someone interesting you'll love to meet. Plus, we have a feature on COVID-19. I'm sure you all know that the major issue now is preventive measures, so put together a feature on that. My name is Nkem Okibe. You're welcome to another interesting edition of Health Watch. Stick around. The program continues after this time out.
Coronaviruses are a type of virus. The one we're all talking about is new, and it causes a disease called COVID-19. Now, most people will only be mildly affected by it, but it can kill. It starts by infecting our upper respiratory tracts, which are the airways from your nose to just above your vocal cords. You may develop a fever as your immune system starts to fight the virus, and a dry cough. That's one where you don't produce any phlegm. The virus can then spread to the lungs, making it harder for people to breathe, and it can cause pneumonia. In the most serious cases, people can die from the coronavirus. This is because the immune system can go into overdrive, and that can lead to organ failure. So we need to do what we can to stop this virus from spreading. As it gets into your body by breathing it in or through your eyes and mouth, the best thing to do is wash your hands regularly and properly for at least 20 seconds. Catch your colds and sneezes in a tissue and avoid touching your face.
If you're just joining us, the program is Health Watch, reaching you on the station for Excellence NTA Lagos Channel 10. My guest today is Oluwasegun Benson. He is the CEO of First Guard Fumigants Nigeria Limited and is also a vector control consultant. You're welcome to Health Watch.
Thank you. Thank you, Ken.
Now, at the intro of our program, we talked about the topic for today, which is public health emergency preparedness.
Okay.
And the reason for this is the outbreak of Lassa fever and also the COVID-19 pandemic. Interestingly, a lot of people have forgotten about Lassa fever, and that is even for me. I think is also a major concern because in Nigeria we have a fact that is transmitted by rats. Yeah. So you are a vector control consultant. The first question I will ask you is, when you're talking about public health emergency preparedness, is there a response plan to attack a pandemic?
Different states and different countries have different measures they put in place. Most states are more proactive than others. You know, I'd only speak for Lagos State because I actually am sort of like involved in the control of Lassa fever within our markets in Lagos State. Well, Lagos State, as you know, it's very proactive. They've put measures in place for any outbreak. Now, if you remember now, I want to talk about Lassa before we go to COVID-19.
Yeah.
If you find out there was an outbreak of Lassa fever recently before COVID-19, and it was, the death toll I think rose to about 2024. It spread across to like maybe 8 states. Then eventually the following week, it was just rising. That was the trend at the time. It was just rising. Now in Lagos, the prevalence of Lassa fever in Lagos is like 0.
Why is that so?
Yes, okay. That's because the rodents that actually transmit the virus, it's a species of rat known as the Mastomys telarensis. They actually have the reservoir for Lassa fever, but we do not have that species in Lagos here. However, experts are saying if you notice in 2014, the Lassa fever, the cases were relatively low. Then 2018, now you see like a trend. It's an upward trend. So so experts would say, okay, what's going on? Is there a mutation in the virus? Meaning, is the virus, other species carriers that we don't know? So of recent, I actually worked in partnership with the NCDC, AfriNet in the Center for Epidemiology, Veterinary Research Institute from VOM. They came to do what they call sample trapping, to collect samples from rodents from different parts of Lagos. We went to Ekpe, we went to different markets, to collect samples to find out if maybe the species of rodents that we have in Lagos, maybe they might have a reservoir for Lassa fever, So that was the operation happened about 2 months ago. So I think the results, I don't know if the results are out, but we did that just to understand, why the sudden surge in that Lassa fever. Now, that was what was happening. We were still battling with that before the COVID.
And you did that this year?
Yeah, we did that this year.
So, based on today's topic, why didn't you do it before now? Why did you have to wait for another outbreak to take place?
Well, nobody saw the COVID-19 coming, if you ask me. I know that, Lagos State was prepared with all the environmental health officers. They were aware of the Lassa fever. Even Ogun State, they flagged up what they call the sensitization on Lassa fever, on educating market people, on personal hygiene in their shops and in their houses and all that to contain Lassa fever. That was the trend at the time. So when COVID-19 came, it sort of like became the trending topic because it was more, COVID-19 was more like the Ebola that we had, So of course, attention had to go because it's a more deadlier virus than Lassa fever. Lassa fever, is not as contagious as COVID-19. So of course, the whole world changed when COVID-19 came from Wuhan. If you agree with me.
Let's go about Lassa fever. We all know that is a rat, some kind of a particular species of rat that carries the virus.
Okay.
And we find ourselves in a city where, of course, you agree with me, there are a lot of rats everywhere. Where you're driving, you could just see one very big rat crossing the road.
Yeah.
So how do you manage the environment?
Like it or not, rat is part of the environment. That's why pest control is about controlling pests, not totally eliminating them. You cannot eliminate life form. Life will always find a way to exist one way or the other. But what you can do, you can control your pests to a minimal level whereby they don't become a nuisance. Now, individuals too must inculcate that habit of carrying out pest control within their homes. For instance, we're saying people, oh, you know what, if you see rat in your house, make sure you don't have rats, make sure your things are kept covered, maybe all your beans or your gari and all those things are kept in containers that are covered. Those are preventive measures. But then, if you also if you actually get involved in the process of killing the rats, what do you do with them? Because that also poses a threat. Okay. I've said this every time I have the opportunity to go on air to educate Nigerians on how to prevent themselves. Rats carry a lot of fever. About 5 types of fever that one of those rats carry, not just the Lassa fever, So what you do, once a rat is dead, it becomes a hazardous waste. You see some of Nigerians, they get blue boards, they trap rats from their house. They all partake because sometimes some of them cannot patronize pest control companies, so they intend to do it themselves. No problem with that. But then the danger in that is, how do you then dispose of the rodent that's dead, since it's a hazardous waste? So my message is very simple. All you need to do to prevent yourself is to, once you've done some form of pest control in your house, get gloves. First, protect your hands, wear some gloves. Then that dead rat, you probably wrap them in a paper bag, not nylon, not a plastic bag, in a paper, like a newspaper. Okay. Like a newspaper. Now, the reason for that, if you wrap it in a plastic bag, it takes time
for it to decompose.
So you use a paper or newspaper, wrap the dead rat, yeah? You can go to the back of your house in the garden or something and dig the ground just 3 feet.
Wow.
Yes, just 3 feet. Dig 3 feet or maybe 2 feet and bury the rats there. You understand? So it doesn't pose any threat. Now, with the trend I see, and I want to educate Nigerians, is like the government has provided bins for recycling. Like now, if you drink water, you can recycle your there's a special bin for you to put your empty plastics and all that. But what if you kill rats? What do you do? Most people don't even know what to do. Okay. They see rat, they throw it in a dustbin. That rat that's in the dustbin would decompose. Flies would come. I don't know if you know those bottleneck flies, those green ones. They would come. You understand? Because they carry maggots. That's the one that lay.
Because of the name you gave, you said bottleneck.
No, the bottleneck flies. It's a special fly. They call bottlenecks.
Okay.
The green ones.
Okay.
Those green flies, they call bottlenecks. That's their name, bottleneck flies. They tend to smell decomposing bodies and feces and all that. So now the fly comes in that dustbin, your dustbin that you've disposed the rat. Yeah. It perches on the rat and flies back into your kitchen, your food, or maybe a restaurant that has a poor hygiene, So what have you really done? What you've done, you've not really prevented yourself properly. So I would advocate that if you kill rats in your house, do not just chuck it in the bin. Wear gloves. Those are the 3 steps you do. Wear your gloves. Get an old newspaper, wrap the rat. Go to the back of your garden or a field somewhere, the nearest field, bushes, dig around 3 feet and bury them there. I know it's a tedious process.
No, actually it's not tedious.
But it is the safest. Okay.
Sorry to cut you short, but the question I want to ask is, because you said go to your garden and then you bury.
Yeah.
For places like Festac, that you have tarred roads and you have cemented roads, how do you manage? How do you have to what do you do to the ground? Especially when it's not your house. Okay,
it's fine. 2 things. Okay, before I even get to that stage, let me say something. If you engage a pest control practitioner, like a public health or maybe an environmental health officer, they'll always tell you if they carry out any pest control activity, they'll come back for retrieval. Most of the pest control people, when they go out to maybe lay baits for rodents and all that, then the rats die. Some companies or some people agree with their clients to come back and retrieve the dead rat because they are trained, because they know it's a hazardous waste. They're trained to dispose those rats properly.
Is there a pandemic response plan?
Like Lagos State, for instance, if you see the response from the Lagos State government, you can see that there's a fair preparedness from the Commissioner of Health and even the Governor of Lagos State. They had preempted that, okay, should we have this, what would happen? So if you can see the level of preparedness of Lagos State, they're pretty much prepared. But now, the question should be, how prepared are they? Yes, sir. They are prepared in the sense that when the index case came in from the Italian, they were able to carry the guy all the way from Owekoro to Lagos Containment Center. Now that was a wise move from the commissioner, because what he did was, if they don't have the facility to contain that, but Lagos State, they have that, one of the isolation centers we have in Lagos State, so it's wise, you understand, for them to have brought the patient here and actually isolated. What if they had left the person in Ogun State? Eventually they have come to Lagos, so that's why I say different states have different preparation. Now, but in case where you have a pandemic and it becomes overwhelming, like what they're facing in Italy at the moment, as an expert in that field, what we'll be suggesting is, if China could build 1,000 capacity bed hospital, so what that tells us is that we can improvise. You have empty spaces, like we can now start to prepare our stadiums. We can say, okay, maybe a stadium in Sulere, we're going to put 1,000 beds to isolate people in a center. In the worst case scenario, pandemic case, that's on the worst case scenario is one situation. So we can actually fumigate the entire stadium, for mosquitoes and all that, then we can build, you don't even need to put any structure, it could just be open. Now, maybe, of course, maybe some tents just to sort of like isolate from sun and all of that. Then you could just put beds, because beds are easier and quicker to build. So we can build beds and can just lay the beds there and make that, and quarantine the whole of that stadium and make it an isolation center.
Brilliant idea.
taking a tour, inspecting maybe a stadium that has 1,000 beds ready for anything, and turn that place to an isolation center and moving some medical teams and things ready to contain. Because if anything happens, if 1,000 or 500 people goes to any hospital in Nigeria, it will overwhelm any state.
True. Fantastic idea.
You know, so
we'll go on a short break. Let's go on a break. We'll go on a short break. Health Watch continues right after now. If you're just joining us, the program is still Health Watch, and today we're talking about public health emergency preparedness. And my guest, Oluwasegun Benson, is still here. He is the CEO of Force Guard Fumigants Nigeria Limited. Before we went on the break, I like the fantastic, I call it fantastic idea you brought on ground, because it's actually good to have a plan B just in case. You know, and to be honest, COVID-19 is everywhere on the news. It's taking over. In fact, it's overwhelming a lot of countries right now. So thank you so much for that contribution. Now let's look at waste disposal and its effect on our health. You agree with me that in Lagos, I would also say some parts of Lagos, you find waste on the road, you find the bins not being disposed. So if we go back to the outbreak, how to contain Lassa fever, and then you dispose your rats, you just see them everywhere on the road or on the bin, and at times the bags they use, you see that the bags are already open, you see the deads on the road, and cars move on the road, and you see dead rats everywhere. How do we manage the situation?
Yeah, okay. So if you agree with me, since the administration of His Excellency, the Governor of Lagos State, Babajide Sanwo-Olu, you find out that Lagos has become cleaner. You know, the indiscriminate dumping of waste you don't see that anymore. So what this present administration, you know, I'd give them a kudos.
We should also give NTA the kudos too, because NTA did a report and we did a follow-up report. We kept bringing in the videos on TV to say, wow, this road disposed, the waste are still on the road, the bins are still there, please take it off.
Yes, you see, like I say, everybody must work. It's a joint thing. NTA would work, the government will work. Like I say, so you're doing your own social responsibility. No, NTA has done fantastic. Like, you know, so I think the governor should, you know, invite you guys for. For supporting his new ideas and all of that, you know. If you're seeing a lot of maybe delays in certain areas, that's because maybe they're still actually working on vendors that would go to that area. I'm not saying that the whole Lagos is spotless, but if you see you can see they're heading towards that spotless Lagos.
Now, the concern for COVID-19 is, I saw a video where, a Chinese video where I don't know what they were spraying in the air. Because we all know that for COVID-19, the virus stays for a longer time on surfaces, door handles, and all that. So, as a vector control person, how do you manage a situation like that where you need to fumigate a house? We all know that it's in droplets that will get into your eyes, your nose, or your mouth. So, how do you fumigate? How do you manage such situation?
Now, I think the word shouldn't be fumigate. The word now should be decontamination. How do you decontaminate against surfaces? And that is why in the wake of this COVID-19, the whole world has awoken to hand sanitizing. You know, if the more people that sanitize their hands, that means the less contagious their hands will be, and the less they can transmit that. So first and foremost is to actually practice self-hygiene. You know, to make sure that you wash your hands. I mean, in the absence of the hand sanitizers, you know, the soap can even work twice as better, better than the hand sanitizers. But then the government too, like I said, should also start what they call some sort of decontamination in, maybe bus stops and, decontaminate areas where you have heavy traffic.
How do you do that?
Yeah, but, you just use decontaminants. It could be, cheap. Now that everybody's crying, there's no money everywhere. You can use cheap decontaminants like hypochlorites. Your hypochlorites can be used to decontaminate surfaces. So at the moment, I think we're talking with the Ministry of Environment, and they are they're kicking off the contamination of like public places, you know, to make sure that all surfaces that can pose a threat, they're doing that. Like I said, Lagos is very proactive, and a lot of states, I think they queue behind Lagos in a way, you know, because, but then they have to, because the demography of Lagos, we cannot afford any outbreak. I just want Nigerians to stay safe. The best practice, like what's trending now is self-isolation. If you know you've been exposed to anybody that's maybe left the country, I've just come back from the country, from any of the affected countries, you just self-isolate, wash your hands, observe yourself. If you have, there are numbers out there the government have put in place. If you have any symptoms, just pick your phone and call the Lagos State. I think it's something that has to do with Corona, but it's a number. Call them and they'll take you from there.
Thank you so much for coming on Health.
Thank you
You
for
said
having
a whole
me.
lot today, and I'm sure that everyone out there, you will not have to pick that out with your hand anymore. You have to use paper to wrap and then bury it, right?
Yes,
thank you so much.
absolutely. Thank you very much.
Moving on, our next feature is on COVID-19. One of the best ways and the only way to contain COVID-19 is the preventive measures. You have to adhere strictly. So see this video, enjoy it. We'll be right back.
How do you reduce your risk of coronavirus infection? World Health Organization recommends the following. Regularly clean hands with soap and water or alcohol-based hand rub. Cover nose and mouth when coughing and sneezing with tissue, sleeve, or flexed elbow. Throw tissue into a closed bin after use. Clean hands after coughing or sneezing. Wear a mask. Masks should not be touched or handled during use. If the mask gets wet or dirty with secretions, it must be changed immediately. Discard the mask after use and perform hand hygiene after removal of the mask. Avoid close contact with anyone with cold or flu-like symptoms. Some patients may already be harboring the virus and still have no symptoms. Thoroughly cook meat and eggs. Avoid unprotected contact with live, wild, or farm animals. Avoid contact with stray animals, waste, and fluids when shopping in a wet market. Wash hands regularly after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, and after handling animals or animal waste. If you have fever, cough, and difficulty breathing, seek medical care early and share previous travel history with your doctor. Avoid public transportation if you are sick and are going to the hospital. Avoid travel if you have a fever and cough. If you become sick while traveling, inform crew and seek medical care early. Avoid spitting in public. Practice food safety. Sick animals and animals that have died of diseases should not be eaten. Infants, elderly, people with other medical problems such as diabetes, heart disease, chronic lung disease have higher risk of dying from the disease.
And that's much you can take on this week's edition of the program. A lot of things were said today, but trust me when I say one of the things we must do at this time is personal hygiene is highly recommended. Please wash your hands often with soap and water, and in the absence of soap, please use the hand sanitizer that has at least 60% to 90% alcohol in it. Send a text message to 07060865487. Send your mails to okibeinkem@gmail.com. My name is Nkem Okibe. Join us next week for another interesting episode. Till then, see you.